Hey everyone. I just wanted to make a quick video because it is coming down to the home stretch and I haven't made one in a little bit, but I had some follow-up appointments. I went to the pulmonologist. I had to reschedule the cardiology appointment for Halloween day, but that's just for approval and for him to say that I'm fine for surgery, which I think he will. And I went to the pulmonologist. I went for the 2 weeks of the sleep study. The first week was where they just hooked me up to the wires and I slept, well, I was supposed to sleep normally, and I said it was I think I said on video, it was the worst sleep I've ever had in my life. I felt like I just closed my eyes and laid there for hours and not really fell asleep, just was kind of there. The second week I went back and they put me on the CPAP machine and they gave me the mask to take home, and yes, it is huge and yes, it is cumbersome, but it covers my whole face like this. It's strapped on. And they hook you up to the machine and it gives you continuous pressure. My pressure was set fairly in the middle at a 12. And even though the pulmonologist said that and the reason why I needed this full face mask, sometimes they'll just do it above the nose like this, but because I breathe through my mouth and I do snore, it has to cover it. It has to cover it all the way. The pulmonologist did say that I do have mild sleep apnea and that he believes that it is strictly due to weight-related issues. So he feels as though once I do have the surgery and lose my weight, that my sleep apnea will be gone. However, he does feel that for right now, he's ordering me a machine for a CPAP machine through my insurance because he feels that it did help me and did benefit me, because the second night with the mask on, I had at least 4 hours of deep REM sleep and full total body restful sleep. And I have to say that the next morning when I woke up, the sleep center, they close the lights at 10 and they wake you up at 6 to leave. Everybody does that. That's just, they get 8 hours, that's it. I left at 6 and I drove home, which was about a half hour, 40 minutes from my house. I drove home and I expected to come home and be really tired like I usually am, and I'll get up at home from my bed, and if I'm off that day from work, I will go to the couch and in an hour I'll be nodding off again on the couch. I literally came home at 6 a.m. I took a shower, I made coffee, I cleaned my house, I folded all the laundry that I had that was waiting for me. I just felt really good and I felt rested. I didn't feel like I had all this, a ton of energy, but I felt like I didn't have to sit down and take a nap. So I took that as a bonus. I'm hoping that when I do have surgery and lose all my weight, that will happen naturally. What a wonderful, wonderful thing that would be. But I haven't weighed myself since the last time because I'm trying, like I said, not to be spastic about it. Today is October 27th. I have my final weigh-in at the doctor's office in 4 days on November 1st. So I have to have lost 15 pounds by that time. Again, freaking out, can I do this? Will they cancel it if I don't get to 15? What if I have 14.6? I'm freaking myself out, which is why I'm trying not to freak myself out by going on the scale. I've also just wanted to give a little, little insight to what I've been thinking about lately. Been talking with a lot of people because up until this point, most of my close friends knew that I was going for surgery, and a lot of the people at work, but more people at my job have been asking me about it and finding out about it because I did get approved for, the time off for the surgery and stuff, so they're asking me what I'm doing. And I tell them, I'm going for gastric bypass surgery, and half of them say, well, you're not that big, what are you doing? And the other half say, oh God, have they discussed the complications with you? Do you know what can happen? Do you know what can go wrong? Yeah, I know. Believe me. Like I said, I wouldn't have gone through this if it was a simple, easy process. Nobody would go through this if it was a simple, easy process and if it was a quick fix. I know it's not a quick fix. I know it's not something that is going to be the be-all, end-all magic treatment for me. I simply know that it will be a physical restraint for me to change my eating habits for good. I'm pukophobic. I don't know if I've ever mentioned that. Yes, I'm a nurse and I'm pukophobic. Everybody has their thing. I can't handle vomit. I don't handle it. I don't do it myself. I've only done it, I think, 3 times in my adult life when I was completely intoxicated and didn't even remember doing it. And I don't deal with it. When my patients vomit, my CNAs know that they have to take over for me. I'm just not good with it. My son has only vomited once in his life when he was little, and it was my son, and it was okay because it was just juice. But the whole thing, ugh, ugh. I have like an innate fear of it. Like some people fear heights and spiders and stuff like that. That's my fear of vomit. So I'm deathly afraid of it. And I know that if I eat improperly or if I try to test myself, there is the potential to get very, very ill. And I do not want to go anywhere near getting very, very ill. I know it will happen. I know I'll have dumping syndrome at some point because I just know that that's just human nature. But I'm trying to avoid it at all costs. I really honestly was thinking about it today, about how much of a change I've made in the past couple of months as far as paring down my diet and really, concentrating on protein. Not just the protein shakes, but getting protein in my food. Um, I had loaves of bread that I've had in my house since, well, they expired in September, so I guess I bought them in August. And my mother finally, they didn't mold or anything like that. Um, but my mother was like, I think you need to get rid of the bread now. It's like 2 months old. You can get rid of it. And the truth is, it's just because I thought I would use it, and I thought I would need it for something, or and I really don't. I don't make French toast anymore, which was a big thing I used to do. I never was a sandwich person except for maybe like a tuna sandwich, and obviously I would just eat the tuna now and not the bread. My son is a very picky eater. He's 5 years old. He's toothpick thin, thank you God. And he's not really a big sandwich eater. So we don't really use bread for anything. Once in a while he'll want toast, but it's very, very few and far between. So, yeah, whereas I can remember when I was growing up, oh my gosh, we used to go through loaves of bread like it was nothing. Peanut butter and jelly sandwiches multiple times a day. And it's just not something I even think about now. I'm not really a big rice person, never really was. I guess pasta would be the biggest thing because I am Italian, so I grew up on it. But I honestly have to say I've had so much pasta and macaroni and spaghetti in my lifetime from having it every day as an Italian that I really don't think I would miss it if I didn't have it again. And if I do have it, I bought like the garden pasta, or the pasta that's enriched with fiber or protein or whatever. So it's not, it's not my mama's pasta that I'm eating anymore either. Um, I don't know. I don't know what the road ahead will be. I'm not fearful of the surgery at all. I'm not worried about the surgery. I have the utmost respect and faith for my surgeon. Um, I am much more fearful of the big picture. I'm fearful of, you know, once I get past that liquid diet that's so structured and so easy to follow and start introducing regular food again, oh my God, like that's what I'm thinking about. I'm thinking about 6 months out and a year out, and of course I'm thinking about the weight and the weight loss and how nice that will be, but I'm thinking, how fearful I will be, kind of like just going through, you know, uncharted territory. But all right, I'm rambling and my camera's going to die, so Thank you guys. I will definitely update. Less than 2 weeks to go. Bye.